Good afternoon. This is Dr. Kevin Lamb talking to you about what a wonderful operating day that I had today. Um, Today I did polar opposites. I had a patient with a high arch foot, and then I had a patient with a extreme low arch foot. So basically, I had a what we call a cavus, CAVUS, foot reconstruction today, as well as a what we call an adult acquired flat foot or a PES planus PLANUS type deformity. Pure contrast, one on each side of the spectrum. You have a flat foot and then you have a high arch foot. Um, so basically, the best foot type to have is the Goldilocks right in the middle. Now, the person with a high arch foot, they tend to be good sprinters, good runner. This happens to be a very good runner. Unfortunately, for the past 20 years, she has undergone many surgeries for her ankle because she's a chronic sprainer, sprains her ankle a lot. Why does she do that? Well, let's talk about. We're going to concentrate on high arch foot, and then we'll talk about the low arch foot. The high arch foot. Now, this is the big toe. This is the fifth toe. This is the right foot. Looking at it. So, person with a high arch foot, the foot is going to look like this. Okay, and from behind, it's going to look like this, almost like a C shape. The heel is curved. So you can see the fibula, which is right about here. You're already crooked already. So if you take a wrong step, you could tip over very easily, either fracture your fibula or tear your ankle ligaments. This is what I look at, the heel bone. Sometimes people with high arch foot, you look in the back, you see that heel curved in like so. So the high arch foot looks like this. You're already at a attitude where you're very prone to spraining that ankle. So this poor lady has undergone 3 surgeries by another specialty, and finally came to our office. And the reason why her surgeries have failed in the past because no one addressed this issue. She was born with a crooked heel. So basically, what I did is what we call a Dwyer osteotomy. Cut the heel bone right here. Take a little wedge out of here, about 4mm wedge out of here, and close the bone. So instead of being C-shaped, I closed the bone, made it straight. So that way, this time when she walks, she'll be able to walk and not be afraid to tip over. Now, what do the lateral ankle ligaments have to do with that? The lateral ankle ligaments are responsible for holding the ankle, the foot in the ankle joint, the mortise, like this, supposed to hold it together. These are the 2 ankle bones. But unfortunately, if your heel is crooked like this, you're going to have a problem. You're going to keep on stretching the ankle ligaments. So in this case, the ligaments were repaired about 3 times prior, and they were repaired fairly well. I think the surgeon did a very good job. The only problem is the heel was not addressed. So this time I addressed the heel and redid the ankle ligament fix. I think she'll do very well with that. Again, for a high cavus foot, they tend to be very good runners, but are very hard They pound very hard on their heel, put a lot of pressure on the heel, and you can get heel pain, back pain, neck pain, etc. But in this lady, she's a classic example of what we call cavus heel, and she's a constant and chronic sprainer secondary to that. So she's going to do well. Hopefully I have a follow-up video of her later on. Now, on the contrast, a person with a flat foot, they're going to have, it's going to be the total opposite. Instead of going in like this, they're going out like this. They're going to go in. Why is that a problem? Well, when you go in like this, all your bones dislocate. The joints back here dislocate, and when they dislocate, the tendons get stressed, the ligaments get stressed, right here. For that patient, there's an older patient. He ruptured both tendons around the ankle, holding the ankle together. Again, collapsing inward, you will tear some ankle ligaments and tendon. This is the inside, the big toe area. This goes into the navicular. That bone is called a posterior tibial tendon or posterior tibial tendon dysfunction. It's a very common problem we see in overweight patients now. And I do have a video on that. If you search my video about posterior tibial tendon dysfunction or adult acquired flat foot, that's basically what it is. For that patient, his heel, now this is the high arch foot, the heel looks that way. They're the total opposite. They're on the opposite end. So what do? Well, we in those patients, If they're too flexible, the joints are dislocated. So I fuse the joint, something called a double orthodesis. We do a fusion here. We fuse this joint, get it back in place, and we fuse these joints, put it back in place. So we relocate the joints in the foot. There's no rubber band. So basically, take away the. How do we do a fusion? We take away the cartilage in between the joint, in between the bones, make it bone on bone, put screws across it, stabilize it, and wait for it to heal. And how that works is the body's going to form a bridge. It's going to form a bridge right across between the two bones. With the screw in place or the staple in place, whatever fixation method your physician uses, or even external fixation, it holds the two bleeding bones together, and the bone will think that it is a fracture, and it will heal itself as if a fracture. Same thing up here. Anytime your surgeon fuses you in the foot or anywhere else in your body, the cartilage gets taken away, the two ends of bone get put together very tightly, snugly, and with a screw, staples, plates, rods, anything that the surgeon is used to using to hold the two bones together. So it's bleeding bone versus bleeding bone, so the bone will think it's a fracture and it will heal. So again, that is a flat foot. A flat foot, you will see, I see a lot of that when I'm out in the streets. A cavus foot, again, you'll look like this. It's curved in. You'll see a nice high arch foot. A flat foot is flattened and it curves inwards towards the big toe, and you'll see the heel going out. You'll see that, we see that a lot in the public. The heel bone is curved out. Now, both are not good. They're going to cause some problems. Today was just an interesting day. It just happens to be one of those days where I get both type of patient in the operating room, and it's pure contrast to the treatment modalities that we have for those two particular type in the surgical realm, because they have both failed conservative care. The other one has been through multiple surgeries already, so it's time to understand the biomechanics and why these patients have this problem and how to address them properly. Again, please visit my blog as well as my other video on adult acquired flat foot. I think this is my first one. I'll talk about the cavus foot. They tend to have less problems, but the high arch foot does cause severe ankle instability at times. Any questions, comments, let me know. NaplesPodiatrist.com. Thank you.